mention it from various ways. Don't want to go into details. I was wondering, when you mentioned that, why is it so much hepatitis C on the West Coast, and when in the Midwest we have cases, but not as much as the West Coast? Is there something different the way we live our lives there?
Probably, I would say people in the Midwest are more conservative. I mean, how people get hepatitis C? It is the body fluid. What body fluid? Blood and semen. I mean, sexual intercourse. For hepatitis C is not the common, but blood. People who use needles, shears, needles, drugs. That is how people get hepatitis C. That's a common. My guess in the Midwest there is this is not a huge problem. In the West Coast, I think big cities, inner cities, that is a problem.
That's a pretty good one, by the way. In fact, Roy, I think the key word is we are more conservative in Midwest, in the Midwest.
I agree. And my second question, I'd like to go back to the bird flu. This bird flu, they're inoculating the bird, and this virus wants to survive, just like anything else. It wants to survive. If we do not inoculate the birds and let it take its normal course, do we prohibit it or make it worse because it wants to survive? Then it mutates into a strain for human form to catch. Is that possible?
Well, that is the difficult question for a cancer doctor.
Okay. All right, then. All right. Well, thank you, doctor.
Hey,
you're welcome.
Roy, enjoy it. Thank you. Let's talk back on prevention. You've talked about the lung cancer. I'd like to get more on prostate cancer, maybe as an example. How can we prevent? You said there's no prevention?
Prevention, usually when we talk about preventing cancer, try to eliminate the cause. What are the cause for prostate cancer? Well, men have testosterone, and can we stop that? They're not men anymore if there is no testosterone. So the prevention here, when we say prevention, is really prevention for cancer is diagnose cancer early. That's the key. Diagnose prostate cancer early. Know about it early, so so we can do something about it. If we diagnose prostate cancer, we can get rid of it. We can cure the patient. If we diagnose breast cancer, curable. If we diagnose lung cancer, curable. If we diagnose colon cancer, that's another one. That is actually a curable cancer. That is simply if someone had a colonoscopy once a year, and we say by age of 50, everyone should have a colonoscopy done at least at age of 50 once, and then every 5 years or so. Because what is colon cancer? It arises from a polyp. That polyp is a precancerous. If you cut it out, remove it, no cancer. And so so when you say screening, I like to use the word screening instead of prevention. For colorectal cancer, you see this card? This is a card that can be used to detect